Fascia is a type of material in the body that literally holds every cell together.
Welcome to PetAbility. I'm your host, Cathy Symons, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, my friend Cathy. How are you?
I'm doing all right today, Chris. What do we got going on today?
Well, you know this story, but our audience doesn't, and I just want to share it because it was a good outcome, right?
Oh, yeah. I helped.
Yeah, you did. I called you right away as my avian expert. So I'm literally just getting out of the shower and I hear the dogs going nuts upstairs. This was like a shriek. And I'm like, oh my God, somebody's hurt. What's going on? I run upstairs. Both dogs are at the sliding glass door. And there is a little, I'll say finch. I don't really know my small bird species very well, is lying on its back. It's quaking. And I knew that it had hit the sliding glass door, right? So I go out onto the deck with a towel, retrieve the bird, and I held it in its little towel cocoon, and it was blinking, and then I could feel like its little legs moving and so forth. In the meantime, I'm frantically trying to call Cathy. Could not reach Cathy, but I was like, okay, I'm going to keep it in its little nesty towel, and I'm going to create a little berm to protect it from the weather, and I'm going to put it in the corner little protected area under the deck, if you will. So, it had shelter. Cathy called me later and she goes, I don't know, you may want to bring it in, a critter could get it. And I'm like, yes, but what if it comes to life and then it's flying around my house? She's like, that could happen. So I let it be. And lo and behold, the next morning, the little towel nest was undisturbed, no sign of any violence or anything like that, and the bird was gone. Cathy says my bird handling skills are amazing. So
they were on point from somebody who's worked with an avian veterinarian probably for about 35 years now, because it's one of my passions is to work with the feathered kinds. This happens more than you think. Birds fly into glass windows all the time and knock themselves out. And sometimes it has a bad outcome. Sometimes those birds die because they've knocked themselves out. And sometimes they just need time to recover because they're stunned and they hit their head. So good job, Chris. Nice outcome.
Anyway, enough of that jibber jabber. So we have a return guest today, Dr. Laurie McCauley. We are thrilled to have her back on PetAbility. This time, Dr. McCauley is talking about fascia or fascia. Many of you may not have ever heard of this, but we all have it, including our dogs. It's not a disease, it's a tissue. So she's going to explain all the ins and outs, literally, of fascia. And I mentioned she's a return guest. We spoke to her and launched a podcast in January 24th, to be exact, of 2023, titled How to Improve Your Geriatric Dog's Health Span and Lifespan. And it is one of our top 5 shows of all time. And I recommend it all the time because I treat a lot of seniors. And what Dr. McCauley emphasized is these exercises can impact not only your dog's physical well-being, but also their mentation, their emotional and mental well-being in terms of dementia and just being brighter and happier. And there's a connection. We all know the mind-body connection. And it's just a great show. So please go back and listen to that.
I love that show. And as the audience may know, I'm like 2 steps away from getting my certification in hospice and palliative care. You would be surprised how much of that show actually relates to a lot of the palliative care patients that I see. And so I recommend it all the time.
But before we dive into the show on fascia, I'd like to remind our audience a little bit more about Dr. Laurie. That is what she prefers to be called professionally. She is considered the mother of canine rehabilitation. She is truly one of the pioneers in our field that has acted as a mentor for both Cathy and me. And again, we're just thrilled to have her back on the show, lending her expertise. So Dr. Laurie has had a lifelong passion to help as many pets as possible live an optimum quality of life. and opened the very first veterinary rehabilitation clinic. She designed the first underwater treadmill for dogs, and she is certified in animal chiropractic by the American Veterinary Chiropractic Association and in animal acupuncture by the International Veterinary Acupuncture Society. Dr. Laurie has trained over 1,000 veterinary professionals globally as a primary instructor at the Canine Rehabilitation Institute for 14 years, mentoring interns from 17 different countries. As one of fewer than 120 veterinarians globally who are board certified in canine rehabilitation and sports medicine, Dr. Laurie demonstrates exceptional expertise and commitment to advancing the field. Dr. Laurie is an international lecturer and contributing author in many textbooks and journals. She was awarded the 2011 IAMS AARV Award of Excellence in the Field of Rehabilitation and the 2015 HAVMA Holistic Practitioner of the Year Award. Dr. McCauley owns Red Tail Rehab, a mobile practice in North Carolina, and is the founder and instructional director of Optimum Pet Vitality, the platform she uses to fulfill her lifelong calling to help as many pets as possible. Welcome back to the show, Dr. Laurie McCauley.
Welcome, Dr. Laurie.
Thank you, guys. That was really sweet.
So let's get to it. You dubbed this show Fascinating Fascia. I want to tell our listeners what it is, why it's so fascinating. So take it away.
Fascia is a type of material in the body that literally holds every cell together. So it holds every muscle cell or muscle fiber in place. It goes around the nerves, around the lymph vessels, around the whole muscle. It literally helps fluid move from the space between the cells into the lymph. It's really, really cool. So one way to do a visualization of this is think about the bottom of the ocean, and you've got these fish swimming around, and you've got these like plants coming up and waving, and the water would be the fascia. It helps everything do what it needs to do. It even goes around the brain and the spinal cord.
I noticed on your website that you say that it's often the forgotten organ, but it seems like it should be not the forgotten organ. It's like a very important function.
Oh, it's huge. It's huge. So think about this. If you have kidney problems, that's an organ. There's medicines for that. You might have fluids. You could have dialysis. If you have liver problems, there's medicines. There's certain foods you should or shouldn't eat that help with that. Even for your brain or like your eyes, right? Oh, eat your carrots, have your retinols, all of these things. But who talks about fascia, right? You can't go to a doctor and say, my fascia hurts, or I have disease with my fascia. Yet it is one of the top causes for chronic pain in humans. So we know it has to be a huge component in chronic pain in dogs.
And there are up to 10 times more innervation in fascia than muscle. How it's got to be a contributing factor to pain.
Right. Well, and not only does it mean that we have the nerves in the fascia that can create the pain, but that also tells us if we work with the fascia, we can eliminate the pain.
Nice.
That's what I love. So let's talk about fascia and what we see as our clinical signs. When fascia gets triggered, we see muscles, well, we can see all kinds of tissue get contracted. So we can have a contraction of a piece of a muscle, and we call that a trigger point. But you can have contraction around lymph, and then the lymph doesn't flow as well, and you can have swelling. You can have contraction around blood vessels, and then the blood doesn't flow as well, and you can have all kinds of problems from that. But the most common thing we see is what we call trigger points, or in layman's terms, is a muscle knot. So if you have a muscle knot, you might say, oh, can you rub my shoulders? Oh, that feels so good. And it's tight and it's hard and there's bumps in there. And then all of a sudden, it's soft and pliable, and that hard bump is gone. And you have just worked on and treated the fascia so that the whole body can relax and work better and glide better.
What's the contributing factor to the development of trigger points in our patients?
Well, trigger points can be caused by many things. Most common we see is either overuse or abnormal use. So think about this. If you are sitting over the computer all day long and you're hunched over and your shoulders are up and rounded because you're working really hard and you're concentrating, and someone comes and starts to rub your trapezius or the muscles in your back and your shoulders, and you're like, oh, that feels so good. What's happened is you have overused or abnormally used those muscles, and then they get what we call sticky, right? Kind of glue-like. Things don't slide and glide the way they're supposed to. And then when somebody rubs them or works with them, and there's lots of different ways we can work with them. We're going to talk about some of those. We can help the tissue itself move more freely. Not only do they feel better, but actually you can decrease inflammation. So inflammation can cause problems with the fascia. And by relieving the problems in the fascia, we can decrease stress and inflammation. If we don't do that, the fascia can not only affect the muscles, but it can, remember, we said it goes around all the tissues, all the cells. It can actually pull in directions that can put pressure on joints and literally change posture. So you can see somebody who's like bent over or twisted to one side and work on the fascia, and then they stand up straight and all their pain is gone. And you're like, wow, we can do that for the dogs.
As you were talking, I was just thinking how many times I've seen a patient who's had surgery, let's say a TPLO, and we've cut through all that tissue to get to the bone to repair the, CCL. And how many times I've overlooked the fascia and not address that, because I'm going to address range of motion and I want to address, muscle atrophy. And how many times have I overlooked the fascia?
Because it's the forgotten organ.
Because it's the forgotten organ, right.
I was just going to say, you may have sewn the fascia back together and then realize that there's scar tissue that can affect the motion. And it may even be the scar tissue of the fascia that's restricting your range of motion, right? Because you can have scar tissue around the joint. You can have it in the fascia. It can be the joint capsule, the tendons and ligaments, but it plays a part in all of that.
Well, it is connective tissue. So it makes sense that we're affecting like that scar. I mean, it's probably different types of tissue than normal fascia, but I know we've kind of described where it is, but what is the fascia exactly? What kind of cells is it?
It's what we call matrix. So the fibroblasts, which are the cells that make healing tissue, those are the ones that secrete it. And then it's like a spider's web. And not only is it like a spider's web, but it actually moves. So it's elastic. So if you imagine like fabric, you can pull it in one direction and it stretches. You pull it in another direction, it may stretch a little bit more or a little bit less, depending upon which way the fibers go. All of the fibers in fascia have the ability, when it is healthy, to be able to move and stretch. And then when it's not healthy, it loses that ability. And then that can cause problems.
Loses that elasticity.
Yeah.
So I want to go back to, because I'm sure a lot of our audience members will relate to this. And so you were talking about sitting at the computer, right? And I can relate to that. Now I'm sitting at a computer a lot more than I was earlier in my career when I was down on the floor with dogs and such more often. If somebody came up behind me and grabbed my shoulders right now, I would probably, I'll scream, vocalize in discomfort.
Mm-hmm.
So it's kind of that. And then, because you're maybe shocked, right? And then it's like, oh, that hurts so good, right? So yes, it feels wonderful once it's relieved, but to get there, to get to that relief point, some discomfort associated with it. How do dogs tolerate that?
Great question, because think about some of the different forms of human ways to get rid of problems. So you have something like rolfing, which is extremely painful, but can do great things. But there's also all kinds of other ways that you can relieve the fascial restrictions without that amount of pain. Now, again, I'm not saying that rolfing is not great for humans. I know a lot of people have done it and are so grateful for it. even with the discomfort. I don't use things that are that uncomfortable for dogs. Occasionally they may turn and look at me like, yo, dude, I trust you. That I feel that. And then they're like, oh, yeah, yeah. Oh, okay. Yeah, I trust you again.
It's interesting because you were mentioned Rolfing. I've actually worked with a structural integrationist. That's what she's working on, is the fascia. Rolfing gets its name from a practitioner who first started treating the fascia in people and, kind of patented this technique and this terminology. Rolfing, you go through a very strict series of tissue manipulation in an order, and that order never changes, and you're treated everywhere from your jaw to your feet. But the order is important, and people who have gone through Rolfing will actually gain like 1 or 2 inches of height because it's relieving all of those restrictions that gravity and poor posture and habits have developed over time.
You think of Rolfing at one end, right? And then all the PT and stretching and manual work. And then if we keep going down that spectrum, we have yoga, right? When you look at a lot of the yoga poses for people, that is directly stretching the fascial lines. So something as simple as that you can totally control. And again, we're talking humans now. It's not like we can get our dogs to do, all the different yoga poses. But at least it gives a visual for our pet parents to go, oh, I can work with my dog and I can do some stretching and some tissue work, and they're going to feel better the same way I do if I do yoga. And all of a sudden, I might not get up and be 2 inches taller, but I feel better and I'm standing taller and my chest is open and I can breathe better and all of that. The other thing I would think about is that the biggest force on our body is gravity. So for us, that affects our spine, and that's our height. But in dogs, it's their legs, right? Because that's how gravity is pushing them down. So they have more compression in shoulder, elbow, wrist, hands, hips, knees, hocks, toes, kind of thing.
Yes. You said something interesting about the fascial line. Is that something that the practitioner can palpate? Can I feel the fascial line? And if I can, how do I distinguish that from like a tight band of muscle or tissue?
So no, you can't necessarily feel a fascial line. If you had a dissection of an animal, you could see it. But once you know how the fascial lines run, then you can stretch it. So you can have the fascial line in a shortened position and be stretching a muscle. And if that has the restriction, then the restriction is the muscle. But if you have the muscle in short and the fascial line in stretch, then it's the fascial line that's the problem. And in reality, the beautiful thing, especially for your pet parents, is it doesn't matter what it is. Once you know that you can fix it, fix the muscle, fix the fascia, and just make the dog feel better.
How about our cats? I mean, they must have the same, right? They must love a myofascial release, right? They must love that.
Oh my God, my cats. Well, think about it. Think about how cats stretch, right? They do their own yoga.
I know you said that, dogs can't really do yoga, but I actually did this in my clinic. I took postures and positions similar to what we do in people, but, extrapolated it to our canine friends and called them by the names of, the yoga poses and things. But it was a class where I brought in the pet parents with their pet and showed them different ways to facilitate through luring stretches that were going to get all of these fascial planes and things, right? So I think that's important to know, that like the fascia going through the body, it's not linear. It's like diagonal planes a lot of times, and diagonal meaning it crosses many planes, right? Front to back, side to side, up and down, and kind of like spirals through the bodies oftentimes. Yeah.
When I see pictures of it, I think of like when you were a kid in kindergarten and you play with the glue, and then you stick it to your fingers and stick your fingers together and just like pull it apart a little bit like a little spider web.
That was a good visualization. So Dr. Laurie, in my experience working with people, I remember there was this relatively new concept, right? Because as you said, you can't really go to the doctor and say my fascia hurts, but people were coming into the clinic and they were diagnosed with myofascial pain syndrome. You know, I had to actually at the time, I'm like, what is that? I had to look it up because it was newly defined. Many of these people that were suffering, literally suffering with this, were told they were crazy and that it didn't exist. So yeah, let's go into that. Is there myofascial pain syndrome in dogs?
We can't tell for sure. We can say that there are ways that we stretch the dogs that they are extremely painful if we put a stretch, more so than if we were just stretching a muscle. I don't know if we have any research behind dogs that we can call myofascial pain syndrome. I do want to talk about how myofascial pain syndrome came about. Janet Travell, who, you know, you call me the mother of rehab. Janet Travell is the mother of Fascia, right? She wrote the first book. She was a cardiologist who said, why do people have pain going down their left arm when they have a heart attack? And it was her dissection of these people and her figuring out what was going on. And what it was when there was a heart attack going on, the fascia would all constrict and contract, and that was causing the pain in the left arm. She's like written multiple textbooks about fascia being so razor focused, like literally hyper focused on what is causing this. And that's what started the whole understanding of what fascia is. And we can continue. And that was like, you know, many, many years ago. And we continue to do research. A paper came out just in, I want to say 2022, that said that when they looked at cells with microscopy, right, it's tiny, 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 every single cell has fascia around it, every cell in the body, and they're all connected. I just scheduled an appointment with a dog. Every time their massage therapist goes to just abduct the front leg, the left front leg, which means to take it away from midline, the dog screams and tries to bite her. And she's like, and we're seeing her every 2 weeks, and it happens every time. And I'm like, that is more than just a tight muscle. Something's going on there. So I haven't seen the dog yet, but that potentially could be a true myofascial pain syndrome.
And, you know, muscle should respond to stretching. But if it's a fascial constriction, then I think it needs to be, I mean, stretching can certainly help. We already talked about that, but there may be more specific treatments targeting the fascia to get it to release, respond. Is that right?
Absolutely. So can I turn my video on now?
Yes.
And we can
Yes,
show?
please. Yes, 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 yes.
I want to show you first a little bit about what normal is. Sid is my perfect boy. Certainly not perfect in all things, but perfect as a demo dog. So I want to show you that every dog, every breed, if you take their front leg and you have their back and neck straight and his head down at 90 degrees, his front leg, I'm cupping his elbow with my palm and bringing his leg forward, and it should come up, right up. I don't know if you can see it because he's black, it's harder, but right to his eye. That's normal. So if your dog's leg can only come forward a little bit, something, muscle, fascia, something is causing a restriction. Every dog, every breed, I'm gonna bring your leg out, baby love. If he's in normal standing position, so here's his back leg, I'm going to now cup, I'm never pulling, I'm only guiding. I'm going to cup his wrist and come back. Every dog, every breed should be able to come to the knee. Then keeping their back totally straight, I should be able to cup his hock and come forward, keeping his pelvis in the same place. And he should be able to come up to his elbow. If he can't, then there's muscle or fascial restrictions. Now, just to give you a quick idea of some of the things that I work on with dogs, I love, 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 love my tuning fork. I can literally take it, and if I have a trigger point in the triceps, come in and put it on that trigger point, and usually within about 20 or 30 seconds, that trigger point goes away. And if there's a strain, so a tear in there, what's going to happen is all of the inflammation, because remember, sound and was going to work on the fascia, and the fascia controls the fluid. So the inflammation goes away, and I can feel that hard spot right where that trigger point, right where that strain or tear in the muscle or tendon is. I can also use kinesio tape, and this is big, I would cut it, but I can put it in places and it lifts the hair, right? Most dogs we don't shave, and humans, it probably works a little bit different, but in dogs we can use it and it pulls up to allow fluid underneath swelling to go down. We can also use it to help muscles stay in a contracted position. Now, again, without shaving, it doesn't work as well as it does in humans, but certainly it's a wonderful tool for people who know how to use it. He's doing really good. He needs a little treat. There you go, sweetheart. And then we have a whole bunch of myofascial tools. So I can tell you, because I'm a learning fool, I've gone through every course I could possibly do. So there's Cranston, which is, they have a human course and they have the equine course. I've gone through the equine course. They don't have a dog course. And there's a whole bunch of tools. You can see my little toolkit here. These tools run about $1,000, but you can use them to work on the fascia, and there's all different sizes. There's different shapes. There's different roundness, whether it be really rounded or more sharp, to have different effects on the tissue. And we can decrease pain. We can turn them on, turn the muscles on if they're not functioning well, or turn them down if they're too tight. So the tools are great. There's also rock tape tools. This one is more rounded. This one is more sharp. So you have more of an effect with one versus the other. And then you can see the different shapes, right? So that you want to use the shape for the right body part, right? So what body part am I using? Which is the best place to use it? Those are also very expensive. I think in general, they're like $700. I think I got mine for like $350. And then I use something as simple as this. This happens to be rose quartz. So it has properties of a stone. I also have one that's amethyst that's absolutely beautiful. But for the right areas, you can get great results, helping that superficial fascia break up and allow the skin to stop being stuck to the tissue underneath. And as you can see, the dogs absolutely love it. They're like, oh yeah, that feels good. And I know one of the questions you're going to ask is, how long is a treatment going to take? And I can tell you that I have done a trigger point in 20 to 30 seconds, an area in several minutes. And when I was going through the Cranston technique course, we did a horse and it took us 3 hours, but we took a horse that was competing to high level competing, which was just, I mean, we just over 3 hours were amazed at the difference in this horse. So that's my little demo.
Thank you, Sid. You were amazing
He was
handsome.
He's so good.
Would you use one technique like the rose quart, or would you, during the course of a session, maybe use a tuning fork and your rose quart, or would you mix them up?
I do whatever it takes to fix the dog.
Yeah.
So I think of everything I have as a tool in my toolbox. So if I'm dealing with a nail, I have a hammer. If I'm dealing with a screw, I have a screwdriver. If I have a piece of wood, I might use a drill, right? So
Yeah.
I promise to always do whatever it takes to fix your dog. While you're in front of me, you have 100% of my attention. And my next client is going to be just like you, and they're going to be happy to wait because they're going to know that at some point it's going to be their dog that needs that extra time and those extra modalities or techniques to fix them and make them feel better.
Can we use other modalities with these treatments? So can I do some myofascial release and then maybe put the dog on the treadmill, or maybe follow it with laser therapy or a CC loop?
Oh, absolutely. In fact, I usually use my hands first. And when my hands don't fix something, then I'm grabbing a tool.
That was going to be my question, is because I don't have any of those tools, but my hands are, probably my greatest asset. So this can be done with hands. You can shape your hands in some of the ways that, those tools are shaped and so forth to affect different things. But as a physical therapist, I have a lot of arthritis in my hands. If I can use a tool and save my own joints, there's an advantage there. But yeah, what were you going to say, Dr. Laurie?
Well, I was just going to say that there's times, the reason I have the tools is because my hands don't fix it, right? So there's times where I'm like, oh, it's not going to fix with my hands because my hands are flattened. And a lot of the tools have blades at different roundnesses, right? So you're going to have more of an effect with a sharper blade, but it's going to be more uncomfortable. So I start with my hands, then I go to a rounded blade. And if that doesn't fix it, then I can go to a sharper blade, knowing that that may be a little more uncomfortable for them. Or I start with the round blade and get them feeling better. And then I can bring the sharp blade in and finish it more quickly because now they're more comfortable because of the round blade.
Let's go back to, how do you identify a trigger point and how do you know it's gone? The term I've heard a lot of times is there's a melting away of that knot literally underneath your hands.
Yeah. So I would say the melting is multi-dimensional. Can I go back on video for a second?
Of course.
So for all of the watchers who get to see the video, what I want you to do is take one of your hands and wrap it around to your other shoulder. And right where your fingers reach, you probably have a trigger point in your trapezius. So reach around and you're like, oh yeah, there's that hard spot. Oh yeah, I feel that. Now what I want you to do is put pressure on it just while you're comfortable and you're like, you feel it. And then take a big inhale and then a big exhale. And push harder as you exhale. Then we're going to do it again. Ready? Inhale. And push when you exhale. And then slowly release the pressure and come back and feel it. It should feel better or back to normal. Isn't that cool? So that's what we call ischemic compression. And that's one that we can do with our dogs, is when we're stretching a pet, dog, cat, giraffe, whatever you've got. When you exhale, they stretch further. I don't know why, but it is universal. I've tried it with all different species because when I teach at LSU, I get the goat, the pig, the rabbit, the ferret, whatever you've got.
Maybe mirroring our breathing, right? We just interviewed a person who does Gestalt with horses, and she was like, they can affect our breathing. Maybe there's a symbiotic thing where our breathing can affect them.
Okay, so can I tell you one more thing about that?
Yeah.
Yes, please.
Yes. So breathing is, it's a form of communication in animals, right?
Yep.
So as a vet, we know that when the leader of the pack takes a quick inhalation, everyone's on alert. So if you're in an exam room and you're trying to listen to a dog's heart and they're panting, I always jokingly say to the client, I'm going to teach your dog a new trick. And I say, hold your breath. And I can hear their heart because they stop panting.
Oh my
Right?
gosh. So you tell the client to do a quick inhale?
Well, no, I do it.
You do it.
Yeah.
I do it. I say, hold your breath. So I'm telling the dog to hold their breath. And then and they hold their breath because now they're on alert.
And then the owner is like, oh my gosh, you just taught my dog how to hold their breath.
And then the exact opposite is true.
Yeah.
Right? When humans are stressed, when animals are stressed, we hold our breath.
Right.
Right? So if a dog is stressed, I put my hands on them and they and they melt, right? They feel better. So when you have a dog and owner, like the owner is afraid that the dog is going to misbehave, or they're afraid that they're going to get hurt, I tell the owner to do the deep breathing, because then the owner is the one that's communicating to the dog, hey, it's okay. I'm relaxed. You can relax. And then both of them are relaxed and my job is easier.
I'm getting ready to take my hospice and palliative care certification exam. And the guy was talking about zebras, and he said, zebras will do the same thing when there's alert. They, one will alert and then they'll red line. They're like, oh my God, boom. But as soon as the danger is over, they green light. That's it. They don't flux like you. Like if somebody came up and screamed in my face, I would be redlining all day long. But they regulate like horses do. They can redline. They're like, oh my God, we're being chased by a lion. And then they're like, whew, that's over. And then they're back to
They're
basics.
back to grazing.
They're back to
right?
turn
grazing.
it, yeah, turn it
back
on
to
and
grazing.
off.
Yeah, I wish I could do that.
So let's talk about the kinds of cases, because we kind of talked in general terms, but it sounds like all beings really can benefit from this, should be assessed for this. But in dogs, I think you'd mentioned as we were preparing for our talk today, like athletes, right? And
Oh yeah.
older dogs. And I don't give us some examples and like why we should especially pay attention to the fascia in these types of situations.
So let's go the other way.
Okay.
Who doesn't need fascia work? The 12-week-old puppy who's Gumby, right? Once they hit maturity, they're going to have bumps and scrapes, and they're going to run into the tree or the wall or your owner's knees or whatever. And then that's going to be a slow progression. As one thing tightens, it affects another. When they get to be like 10 or 11 or 13, we call them train wrecks, because it has literally been one problem compounding the next. And then we have to unwind. I call it peeling the onion. You get rid of the most painful part, and then you slowly peel until you get to the root problem, so that everything feels good. So pretty much, unless you're a 12-week-old puppy or a kitten, fascia work can help.
And probably with certain dogs, because you mentioned earlier, like overuse or underuse. So, I think about those dogs in obedience, for example, that are constantly looking up at their owner on the same side of the body. I'm like, how can that be healthy over the span of their life? Yes.
Yep, absolutely. I teach my clients that do obedience to heal on both sides. And when I worked with the police dogs, they had to heal. I mean, their major heal is on the non-gun side. So it depended upon whether the handler was left or right-handed, because that's where they would keep their gun. But then we would also teach them heal means your neck is attached to my leg. And then I can walk forward and you're walking backwards, or I can walk backwards and you're walking forwards. I can walk to the side and you are just keeping yourself, you're paying attention to me. And we can do neck exercises. So I think it's extremely important not only to strengthen the legs and the trunk, we talk about core, but the neck is also important, because so many dogs have neck issues, not even just obedience dogs. And keeping it strong and keeping the fascia fluid prevents it. If anyone's ever had their neck hurt, which, I think
I do.
most
I do.
humans, right?
Yeah, right.
Right? Dogs are the same, right?
Preventative measures, really, right?
Yes,
Keeping
we
the
can
fascia
definitely
healthy.
prevent it.
And
Yep.
you mentioned core, and I think that this is a good spot for us to say, or to tell people, that Dr. Laurie actually has a class called Core and More, which I loved. So
Thank
I
you.
think they can get that on your website, right, Dr. Laurie? They can go to your website and check
Absolutely.
out Core and More. And you know what?
Yep.
It applies across the board to just about every, unless you're maybe the 12-week-old puppy, but maybe even the 12-week-old puppy, it applies across the board to all dogs of different ages.
So I know one technique that has really, I think, more recently come into favor on the human side is dry needling. And we also use that in canines. Can you describe that for people?
So I'm going to back up 1 second. When I learned about trigger points from Janet Travell's work, one of the things they said was a trigger point can be anything from a group of muscle fibers that are in contraction. So not the whole muscle, but just a group of them. And that's what we call a trigger point, all the way to the point of a non-encapsulated fluid-filled cyst. So literally like a little balloon, but without the balloon part of it, fluid in the muscle that's causing pain and problems. And if you've ever felt it, it'll feel like a soft M&M in the tissue. So you can go in with a needle and think about going in and affecting that. Also, when you put the needle in, there's something called a Golgi tendon organ, right? But it's this little mechanoreceptor inside the muscles that are telling the body where everything is in space and what to do. And they are like on fire. They're like, okay, we're holding it in contraction. And you release them, and you have what we call a twitch response. So you stick the needle in and you're poking around and you get this twitch response. And then all of a sudden that muscle that was in tension is now relaxed. I don't want any of the pet parents to go home and start sticking needles in their dogs. Know that you have to be trained. It's not super easy. You need to know what you're doing. And if you have someone who knows what they're doing, it's amazing. And my PT has dry needled some of the trigger points in my back, and it can be uncomfortable, and it's wonderful when they're done.
I think, again, it kind of speaks to the tools in the toolbox, right? So
Mm-hmm.
we talked about all the tools in terms of, fascial manipulation and so forth. But, we've mentioned acupuncture earlier, this dry needling, which is different than acupuncture, exercise, targeted exercise, taping, stretching, massage. I mean, it just goes on and on in terms of, what could potentially be beneficial. But you have to know what you're treating to get the best effect fastest.
Yes.
We have to tailor these things towards the patient. What's their pain? What are we treating? And then one dog might be different from another dog.
So it all goes back to seeing a professional for a good assessment. We can't guess at what we're treating, right? So there are many things that can be helpful, but know what you're treating and how best to treat it. And some things are better done at home or can be done by the owners. We can outsource them from a clinical or professional situation, but others need to be in the hands of a trained professional for sure.
The only thing I would say to that is, but don't be afraid to try. Right? So I may not be a massage therapist, but if I rub someone's shoulders, they're going to feel better. Right? And, when you have your pet, if you start to touch them, touch in itself releases different hormones that decrease cortisol, which is our stress hormone. So every time you touch them, whether it be rubbing their belly or massaging their hamstrings or their triceps, which is, just above and behind the elbow, rubbing down on either side of their spine, they go, oh yeah, that feels good. Let's think about it like if you're going to a restaurant. You can go to an amazing restaurant with someone who really knows what they are doing. They're a master chef, and you have a meal that is to die for. People pay a lot of money for that. And you can go to McDonald's, right? Someone who's, they're slapping a hamburger on a bun. It's still food, right? So it's not, there is a huge variation, but don't not do it because you're not an expert. Do what you can to help your dog, and then what you can't, let the expert do.
We talked about this on other shows about owners being afraid to touch their dog because they're afraid they're going to hurt them. But I think, again, it's all about listening, like we talked about before, listening, getting consent, and just sort of naturally following your dog's lead. My dog doesn't think I'm qualified to give him a massage, even though I'm a CCRP, but but I let him lead. So I know that he likes to have his back rubbed. I know that he likes to have his neck rubbed. And I know that there are times when I doesn't want me to rub his shoulder. And when that happens, I take him to my friend Sam Henke, who we interviewed before, and she's a massage therapist and she does it for me. But I don't think you should be afraid to touch your dogs. I think you just need to listen to what they're telling you.
Getting that baseline early. Before they have problems. Well, you said basically after 12 weeks, they're going to be starting to have problems. But what does normal, supple tissue feel like? And then you're better able to identify as your dog matures, as they may get an injury and they can't talk. And so we might not even be present or be able to identify when an injury has happened, but you can feel it. So getting your hands on your dogs, moving, their joints back and forth, feeling that tissue, what is normal, then you can appreciate what may become abnormal over time.
And that normal tissue is going to feel soft and pliable and not have pain on palpation. And I think that abnormal muscle is often going to feel sort of hard and uncomfortable when moved and sort of resisting that stretching. So I think it's good to familiarize yourself with your dog's body anyway, for all kinds of reasons, not just muscle reasons, but finding your lumps and bumps and seeing what's normal and what's not normal and what comes up. But I think you should get your hands on your dog and familiarize yourself with their body.
I think that's a great suggestion.
So I also think we need to remind people that yes, there are, in layman's terms, knots in the muscle, but in practice, I have found I would say exponentially more taut bands, lines of muscle tightness, because they have an origin and an insertion. And when part of that muscle from the connection points gets tight, it feels like a rope. Can you expound upon that?
I would love to. So for any one of you guys who are a runner, you will totally get this. And if you don't, if you're not a runner, go running. No, just kidding. If you haven't run for a while and you run, what's going to happen is you're going to come home and your quadriceps, the muscles in front of your legs, between your knee and your hips, are going to be tight. That is a tight muscle. That's from overuse or abnormal use, and that's the whole muscle. A trigger point is when a subgroup of that muscle. So remember, a muscle is made up of muscle fibers. And what's really crazy is every muscle fiber is one cell. So you can have really long cells that you can actually see, right? And if you have just some of these fibers that are contracting, and they're contracting abnormally or overuse, you can get a trigger point, like we just talked about in the trapezius, in the back of your shoulders. It's not just from overuse. Think about if a dog hurts their knee, right? So many dogs get cruciate injuries, and they're shifting their weight to the other side and they're picking up their painful leg. So everyone goes, oh yeah, well, the other leg is more underneath their body. So it's in an abnormal position, and then they're having to hold all of the weight. So now it's overuse. But in the other leg, the quadriceps are the ones that are holding it up all the time. By golly, they get really tight too. So the ones that are in the leg that they're not even putting weight on are being overused, and those muscles can have problems too. So there's all kinds of different ways to see about it, but the trigger points are a piece of the muscle. When we talk about a tight muscle, it's the whole muscle. And the other thing I want you to think about is sometimes what feels like a soft muscle has a trigger point in it, and you don't find it until you stretch it. And then you go to stretch it and you're like, oh, it doesn't stretch all the way. And now when I feel it, bingo, I can feel where that trigger point is. And that's where I can have the biggest effect.
You know, you talked about ischemic compression. We did that demo with our trapezius. What's the rubber band technique? So Dr. Laurie, I just asked you about something I saw in the outline called the rubber band technique. And so what is it? Never heard about it. Please.
Okay. So it's my technique that I have found that works really, really well for long, thin muscles. So if you imagine a rubber band and you take it, right? It's short, and you take it and you pull it this way, it's elongated. And then you bring it this way, it's shortened and then elongated again. So think about, like, if you were doing a whole bunch of bicep curls and then your biceps were really tight, you could come here and go back and forth, right? So you can see it a lot easier when you do the triceps, right?
And that's all muscle.
And that, of course, it's all muscle. But now let's look at the dog. If we take his triceps, can you see this well enough? Do you want me to bring the camera closer?
We can see it pretty well, I think.
Yeah, okay.
I feel like I can.
So I can come in here and I can come up and down and soften that muscle, right? I can do it on his forelimb flexors. I can do it. Can I have your leg, please? There you go. And come to his hamstrings and do it, or his calf muscles. Can you see how much motion there is in that?
Yes. Yes.
That is wonderful for releasing the tension. So when you have a tight muscle, just doing that. Now, is it going to be as good for a trigger point? No, but for a tight muscle, it is a wonderful technique. And again, like 10, 20 seconds.
I've used that technique, not calling it the rubber band technique, but again, when you talk about fascia and that it interweaves and combines and goes in all different directions. When we stretch linearly, origin to insertion. And now you're manipulating that tissue in a different plane. So you get, like you said, it softens the muscle and it's opposite, it's perpendicular to the typical line of stress that's caused through a contraction and relaxation.
Yeah.
So yeah, super effective. That's cool. Dr. Laurie, I think one of the biggest things that people need to hear is that this is effective without the use of drugs, adding more drugs, etc. It's a drug-free option to decrease pain, increase mobility, generally improve, quality of life and well-being in our pets.
So in general, humans and animals live in a cycle as we age, where it's, I maybe have a little ache or pain, so I'm less active. I'm less active, so my muscles and tendons and ligaments. So tendons and ligaments atrophy as well as muscles do. And atrophy is getting smaller and weaker. And when I do that, then the joints themselves actually become more unstable. There's a little bit of laxity in there. And when that happens, then it creates more inflammation. And that inflammation makes me more uncomfortable. And now I'm more uncomfortable, so I'm less active. And we cycle down and down and down. And we see as our dogs or humans age, a lot of them get less active and they cycle down, 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 down. My goal in life is to educate so that we can get them feeling better, so they become more active. They become more active, so they hypertrophy, so they get stronger and more muscle, tendon, ligament, so their joints become more stable, so they're more active, so they're stretching and they're getting exercise, which decreases the inflammation and the pain, which makes them feel better, so that they become more active and they cycle back up. So that to me is so, so, so important, because we talked about like lifespan and health span, right? I don't want to live to 120 if I'm going to be really achy and painful. And the best way to do that is to keep my muscles, tendons, and ligaments strong and supple. And that to me is super, super important.
Yeah. Movement is
movement.
Key.
Yep.
And that vicious cycle, it doesn't take long. I often talk about inertia, right? A body in motion stays in motion, a body at rest stays at rest. So we have to, flip that around in all of us, people, animals alike. But, I find that so many of my pet parents out there, my clients, are seeking earlier, more holistic approaches to treatment versus throwing drugs at the problem. I mean, certainly medicines have their place, but and we were talking about all these different techniques to treat fascia, and it's drug free, so it's a great option to pursue. Yep,
absolutely. My general rule of thumb is better living through chemistry when needed.
I'm going to incorporate these into my practice. A lot of my senior patients, my hospice patients, my palliative care patients. And honestly, Dr. Laurie, I see a lot of exotics. So I'm thinking about my bunnies and my guinea pigs and maybe even some of my avian patients. I don't know how they'd feel about that, but I'm willing to give it a try.
Well, think about this, just putting one of the birds on your arm and slowly bringing it down so they bring their wings up. So even if their feathers are trimmed so they can't fly, that's still working those muscles to help them feel better. And they need those muscles and that change in balance and proprioception to keep feeling good. Yep.
Yeah, it's important. So, and if you're a bird and you're an Amazon, you might live 100 years. So you got to stay mobile. You got to stay mobile.
Yeah. Well, and think about it. If you're in the Amazon and you don't stay mobile, you're lunch.
Well, thank you, Dr. Laurie. It's always a pleasure to have you on our show. And it's always an honor to work with you and just have you come on and educate our listeners. So thank you very much.
Oh, thank you guys. Thank you for having me and for doing what you do. You guys are awesome. I am so appreciative of you guys helping pet parents and professionals learn more, being a place for people to go to learn more so they can help their pets and their patients. So cheers for you guys.
So Dr. Laurie, as we're wrapping up here, let's tell our audience where they can find you, your website, Facebook, Instagram, all that good stuff.
Sure. So we are on Facebook under optimumpetvitality.com, Instagram, I think it's optimum.pet.vitality, our website, optimumpetvitality.com. We're on YouTube, where we've got hundreds of videos with free information on our website. We've got Learn and Goes. We've got almost 100 videos there that have all kinds of really cool information. We post lots on Facebook and Instagram. So follow me everywhere, and I would be happy to continue to teach you. On our website, we have a place that you can get our Learn and Goes. They come out once or twice a month. You can learn all kinds of good stuff there. And then the last thing I want to tell you about is that on Wednesday, August 28th, I'm going to have a webinar on fascia with lots more information. And that's at 8:00 at night, Eastern Standard Time. And Chris and Cathy are going to have it in the show note, the link that you can sign up for that webinar. It's totally free. We would love to have you. And if you like, oh crap, I really want to do it, but I have to take my son to Boy Scouts. That's okay. Register and it'll be recorded and we'll send it to you.
And a lot of these resources are free, right? Like,
yes.
Yeah, the Learn and Goes, and are those all free?
Yep, absolutely.
Wow.
I love to teach. Again, my passion is empowering people, optimizing pets.
Well, once again, thank you so much for being on the show. You are such a witty and dynamic speaker, and I always just get giddy when we get together. So let's continue this collaboration. All right.
Yeah, absolutely. And thank you to you guys. You guys are amazing. I so appreciate you taking the time to put things together to help the pet parents and the professionals continue to learn and grow and help the dogs and cats and birds.
All in this together, right?
Yes.
Well,
Awesome.
thank you.
Thank you.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.